Let's speak about the types of medical studies. Refreshed, please. Please. Okay? Okay, types of medical studies and scientific publication. This is a very short presentation about the algorithm only. I will not go in depth in the types of medical statistics. Do you remember yesterday we have to choose your study design. Exactly? Okay, so choosing the proper design is a must. Exactly, for a successful research. Okay, why? Because each study design yes, has specific requirements, and each study design answers a specific question. Okay? So I'm going to give you an example. This is a dormitory, for example. Dormitory for students in a university. I'm giving you this example because suppose that I have some money for business. I went to the contractor. I said to him, I wanted to make some business in building. Okay, the first question he will say to me, what do you want? What's your design? It depends on many things. Okay, this is, for example, a dormitory for university campus. This is a single room apartment, and this is a family room, a family apartment, and this is luxurious palaces. Okay, can I go to the university campus and invest, and can I build palaces or villas? University campus? Can I go to these luxurious areas and then build a very primitive houses? So each study design has specific needs and satisfy certain requirements. If you say to me, I'm going to invest in the university campus, I will say to you, okay, we are going to build the dormitories, okay, or single room apartments for the people. However, if I'm investing in luxurious areas, now I can make another design which is palaces. Okay, the same idea. Just input this one, the same idea. If you come to me, say you are going to say to me, I'm going to make a research. I will tell you what you want to search about. Okay, what's your area of research? Okay, just to go to Google and write types of medical research, you will see a lot of medical research types, which is really bad and difficult for me in the beginning to be understood. Okay, so we have better to have algorithm. What about to have simple algorithm? Okay, in teaching I can't teach people all of those one block. They never be understood. But if I give you a tree, okay, it will be easy. Okay. Doctor?
If you want to study candidate satisfaction after a lecture.
This is a requirement now. Which study design will give me this requirement? Survey or exactly survey type. Okay.
If you want to study the prevalence of a certain disease or in a specific area, you have to choose
case report. Okay. Okay. Cross-sectional study. Prevalence cross-section. To understand?
What is the preferred study if you want to study a new medication or device? Clinical trial.
Exactly, a prospective clinical trial. You see? So now, as you see, this is the villa or the apartment. It changes based on my requirements. So each study design gives or clarifies or satisfies certain question. Okay? Let's go? Okay. So ask me, what are the domains? How we can determine? I want to now to choose the study design. The first domain is your materials. Your materials. The first question asks if you are going to do any study or any research. The first question is what are your material? I'm going to work on already published data, or I'm going to work on patients. If I wanted to do a systematic reviews, do I have to have a patients? No. If I'm going to do a meta-analysis, do I have a patients? No. If I will write the editorial or review articles, do I need a patients? Exactly. But if I have a patients, I'm going to ask myself the second question. Do I have a small number or considerable or big number? This is the domain number 2. And then, intervention. I will explain. Are you going to intervene? Are you going to change their clinical course or not? And finally, the time. Are you going to study now or looking backwards or looking forwards? Easy? Let's take step by step. The first domain is patients or already published data. I'm going to just drop this out now, because in the second level, to write a review article or something, it's not an easy. But let's start at least in those. The second domain is the number. I'm going also to drop the considerable or big number now. I'm going to work now on small number, which is case series. So easy. So if I'm working on patients, I have small patients. It is a small number. I can't say I will do a cross-sectional. I can't say I will do cohort. It is a case report case series. Finished? So those are the easiest two articles that you can start with. This is my advice. Start in case series, case reports. Because they are easy, there is no statistics, there is no results, there is simple discussion, so you can do some training. Do you remember yesterday we said just to do on driving on surface route? This is your surface route, okay? Please open your handouts, please. And I'm going to give you a couple of minutes only on the case report. What do you expect about case report? Very? Okay. Nice story. What else? What about this case? It should be what? Rare. Novel. Uncommon. Exactly? Fine. I'm going to give you a couple of minutes. Which page? Yes, this one. Page 19. This is, okay? Page 19. The separate one. Okay? Just giving you a couple of minutes to just read the introduction. Read the introduction. What is the rationale? The rationale of this case report. Okay, guys? Okay, look at me, please. So, what is the case report? Can anybody read? Detailed report and interpretation. Okay, so this is a report and interpretation on the same time of one individual case, typically a novel or uncommon disease. Okay, usually it's written by or as a story. Okay, this is the case report. Okay, suppose that I have 4 cases, 5 cases. It will not be a case report. It will be case series, exactly. Look to this example. Among 2,000 bladder tumor cases, don't bother by the technical terms. Among 2,000, we have only 6 patients which had a unique diagnosis, which they had inflammatory pseudotumor. They had physically or by naked eye examination, it is a tumor. But every time we have a biopsy, no tumor. And then they proved they had inflammatory pseudotumor. And then after follow-up, they didn't get any recurrence. So this is a case series. So a case series is a group of series or patients who have a similar clinical outcome, similar treatment.
More than one it will be series? Even 2?
1 or 2, it is case report. You can say case report of two cases, but you can 3 case series.
More than 3?
Yeah, and 3, 4, okay? So it is a case series. Just I'm going to give you another couple of minutes just to flip the page. Okay? Just read only the introduction, the rationale of the case series. Don't bother by the technical terms. Don't bother by, just see why. The rationale of being a case series. Small number. So it will be Case series. So those, I think now, finished? Easy? So I'm going to work again on, not on, already published data. And about the number is? Considerable number. What is the second domain? Time and before time? Exactly. Is. When you intervene or not will determine the time. If you intervene, it will be experimental. All experimentals are prospectives. No experimental retrospective. Okay? And if there is no intervention, it will be observational studies. Just I'm going to start with the observational studies. 3 types of observational studies determined by time. If I am taking a snapshot now, it will be cross-sectional. Cross-sectional means, it doesn't mean that you have to do it now, but we're going to explain the exposure and outcome at the same time. I can do a cross-section for 6 months, that's okay. But there is no follow-up of the patients, okay? So if I'm going to work in the meantime, it will be cross-section. If I bring the diseased patients and I look to their clinical files, it will be retrospective. If I bring healthy individuals and I follow them up, it will be prospective or cohort study. Take one by one. This is what. What's the question here, or the study question? She wants to know the clinical characteristic of depression. Okay, so she did what? Questionnaire in the now or in the past or in the future? Now. So all surveys, all questionnaires are cross-sectionals. Okay? And so if you see any prevalence, if you see any questionnaire, it will be a cross-sectional study. Another example, the ministry, for example, asked us what the prevalence of diabetes in our city. What you are going to do? I will bring random, for example, random people, and I will test for them, for example, for sugar and hemoglobin A1C, and then I will say the prevalence is, for example, 20%. Did I follow up the patient? Did I look to the clinical files? No. So cross-section is in the meantime. If you wanted to remember cross-section, it is like a snapshot. That's it. No looking back, no looking forward. Any questionnaire, okay, it will be cross-section or surveys. Okay. This is easy? It's easy, huh? Okay. Go to the case control study. Okay. If I have, if I have a rare disease, for example. I have what? A rare disease. Okay? If I have a rare disease, like skin cancer, for example. Skin cancer, the risk factor is known sun exposure. Is it practical to bring people, healthy people, do not have a skin cancer, and then follow them on sun exposure for like 20 or 25 years? I think that we need generation to follow up this study. Okay? So, makes sense to do it retrospectively. Okay? Yes. So, if I bring patients who have the disease now, okay, it will be a little bit cost benefit. Yes, exactly. This is the aim of case control study. So case control is retrospective. Why? Suppose that it is a rare disease. Sometimes it's economically, okay, because you have now the old patients with you. No need for follow-up. Okay? So here, you see here, among all male, such and such, 42 1,000 cases of non-melanoma skin cancer. Skin cancer. Consider this a skin cancer. And then he studied the risk factor, and then he controlled with population controlled matches. He controlled with people who didn't have sun exposure. He wants to know now if the sun exposure is a risk factor of skin cancer or not. So the exposure is this is exposure, and the outcome is skin cancer. The exposure is outdoor. The outcome is okay. So I will bring two arms. Okay, the first arm who exposed, and the second arm who non-exposed. Just put this in your mind, and then the next lecture I will explain. So a case control is a retrospective study to study the risk factor for a certain disease, and usually it's compared with control, which are people who are free, they didn't exposed. So I compare exposed to non-exposed to see is this a risk factor or not. Just to know the case control is a retrospective study. In reality, we do retrospective analysis of the clinical data. This is one of the gynae I shared with my colleagues in Ivory, and then they collected data about certain disease, and when we brought data about people who didn't take this intervention. So now we consider we have a control group. Okay, you see the role of such and such and such, a retrospective matched control. Matched mean matched in age. So if you are fair, you have to bring a matched group. Matched in what? In age, in gender. It should be similar. Don't, for example, if your study population is the mean age of 50, don't bring another control group with the mean age of 10. So you have the control group should be matched or similar. Okay. And this is also my experience, one of my publication of experience, retrospective experience. So we are going to go to do more retrospective analysis more than case control, because case control expresses the risk factor of a disease, but we are a clinician, we do more the retrospective data, retrospective studies about our data. Okay, so cohort study. What does it mean, cohort? Group. Yes, a group of people who are or sharing certain experience, and they are free of the disease in the beginning. This is a cohort. I will explain to them in the next lecture. But cohort group, they are healthy or diseased in the beginning? Healthy. Okay? Then I'm going to follow them prospectively. So cohort group typically is a prospective. However, sometimes you will say retrospective cohort. That's okay. Observational study. According to the time you have cross, retrospective, prospective. And then we finish those, and then we're speaking about what? Experimental, if you study a new medication or new device. Okay. We'll speak about controlled, non-controlled, blind or non-blind, randomized next lecture. But I want to just to review the algorithm again. Look to this one. What the study? Exactly. They studied certain medication with placebo. It is a retro or pro? Always prospective, because it's a clinical trial. Okay. So we finish those. I'm going to you have to imprint the next algorithm in your mind, please. Give me a few examples for already published data. Meta-analysis, okay. If I have patients, the next domain is number. If it's small number, if it's considerable, intervention or not. If it's observational, no intervention, it will be time.
So at the end, please remember the 4 domains that determine the type of the study. The main domain is the materials or the subjects. Either you are going to work on already published data or patients. If you're going to work on patients, the following are the domains: the number of patients, intervention, and time. Let's apply on the following chart. So, are you going to work on patients or already published data? If you're going to work on already published data, there is no need for patients. Give me examples. Yeah, systematic views, meta-analysis, mini-review, letter to the editor, all of those are examples of working or publications on already published data. If I have patients, the second domain is the number. If I have a small number, it will be case report, case series. If the considerable number, what do you think the next domain? Intervention. If there is any intervention, it will be experimental studies, and all experimental studies are prospective. If there is no intervention, it will be observational study. What's the next domain that determine the type of observational study? Think with me. Time. Exactly. If the exposure and the outcome at the same time, it will be cross-sectional. If you look backwards, it will be a retrospective case control. If you work in the future, it will be prospective or cohort study.
I want from you, just in this course, to know this algorithm.